She walked into the hospital room, not with the swagger of authority, but with the quiet power of someone who truly understood what it meant to care. Lydia Hall was not a household name like Florence Nightingale, but in the world of nursing, her influence was seismic. Her ideas didn't just shape patient care, they challenged the way nurses thought about their very role in healing. Born in 1906 in Maryland, Lydia Hall grew up in a world where nursing was considered little more than a vocation, a dutiful job for women who had few other options. But Hall saw it differently. She believed that nursing was an art, a science, and something profoundly human all at once. Her journey into nursing was not just about wearing a uniform or following orders. It was a mission to redefine what it meant to heal. Hall's most revolutionary contribution is known today as the core, care, cure theory. At first glance, it sounds simple, almost intuitive. But beneath that simplicity lies a radical understanding of nursing as a balance of three intertwined forces. The core represents the person at the center, their spirit, their individuality, their needs beyond the obvious physical ailments. The care is the nurturing, the human touch, the emotional and psychological support that can be as vital as medicine. And the cure, that is the domain of doctors and treatment, the clinical interventions that fight disease. Hall argued that for nursing to be truly effective, all three elements must coexist in harmony. Imagine a patient recovering from surgery. The surgeon's knife may remove a tumor, but it's the nurse's empathy, attentiveness, and understanding of the patient's emotional and psychological state that often determines how fast or how fully that person recovers. Hall saw nurses as more than assistants. She saw them as co-healers. But Hall's theories didn't emerge in a vacuum. She studied at a time when nursing education was heavily regimented, almost militaristic in its approach. Training schools focused on procedures, efficiency, and obedience. Hall observed that patients were treated as cases, not humans, and she knew something had to change. It wasn't just about adding empathy, it was about reframing the entire philosophy of nursing. One of the most fascinating aspects of Hall's approach was how she recognized the invisible labor of nursing, the subtle, almost intangible skills that are often overlooked in textbooks. The way a nurse listens to a patient's fears, the small acts of encouragement, the attentiveness to body language. Hall argued that these were not soft skills, but core components of healing. In her view, neglecting them was akin to performing surgery without understanding anatomy. Her work was met with resistance. Critics called it touchy-feely nonsense, claiming that nursing should be about efficiency and scientific rigor, not emotional insight. Yet Hall persisted. She argued that the art of nursing was as critical as the science, and she provided a framework for integrating both. Over time, her theory gained traction, influencing nursing curricula, patient care protocols, and the broader conversation about health care. Hall also had a knack for observation. She could watch a patient for minutes, almost invisibly, and notice subtle signs of distress that others would miss. She believed that caring was not just a set of actions, but a state of being. Nurses, in her philosophy, were like mirrors, reflecting attention, empathy, and understanding back to patients, creating a space where healing could truly occur. Perhaps the most emotionally resonant part of her legacy is the way she honored the patient's individuality. Hall insisted that each person was unique, with their own fears, hopes, and coping mechanisms. The nurse's role was to meet them where they were, to navigate the intricate web of emotions and physical needs without judgment. In many ways, she anticipated what modern holistic and patient-centered care would later embrace. Hall's influence extends far beyond hospitals. Her theories have shaped policy discussions, training programs, and research on patient outcomes. Today, nursing is recognized not just as a technical profession, but as a multidimensional practice that blends science, empathy, and human connection, a perspective Hall championed long before it became widely accepted. And yet, for all her brilliance, Lydia Hall remained quietly dedicated to her work rather than fame. Unlike some of her contemporaries, she did not seek the limelight. Her legacy is embedded in every thoughtful touch, every moment of presence, and every nurse who understands that healing is more than treating symptoms. It is about engaging with the person who carries them. In a world where healthcare often feels mechanical, Hall's vision reminds us of the human heartbeat behind the hospital walls. The core, the care, the cure, they are not just theoretical constructs. They are the invisible threads that connect nurse to patient, science to art, and procedure to compassion. Lydia Hall may not have sought recognition, but her ideas continue to ripple through the nursing profession, quietly shaping the way care is delivered, how patients are understood, and how nurses see themselves. In a very real sense, she transformed nursing from a job into a calling, from a series of tasks into a profound dialogue between healer and healed. Her story is a testament to the power of observation, empathy, and vision. It's a reminder that sometimes the most revolutionary ideas are not loud or flashy, they are quietly, patiently reshaping the world from the inside out, one act of care at a time. And in the halls of every hospital, her legacy whispers in the footsteps of every nurse who stops to listen, to touch, and to truly care.